In the following interview, I had the opportunity to speak with Dr. Dixon. She is a psychiatrist by trade from New York State, and she works for the New York State Psychiatric Institute. She is heavily involved in clinical mental health service research. In our interview, Dr. Dixon discusses the OnTrackNY State program, which serves young adults who experience psychotic illness. She also discusses the services offered by the program, the Youth and Young Adult Leadership Council, what psychosis is and why it's important to address it so early, and how it's important for young people to support each other through mental health difficulties. I hope you enjoyed and learned something from this interview.
Thanks for inviting me. My name is Lisa Dixon, and I am a psychiatrist by training. I am a native New Yorker. Spent a lot of time in Maryland, but came back to New York. I am employed. I work at the New York State Psychiatric Institute and work in some sense both for the Office of Mental Health for the state of New York and also for Columbia at a dual appointment. And I've spent a lot of my time doing what I call like clinical mental health services research. So that's involved with trying to understand how to make services better, how to develop evidence-based practices. I run a division that is focused on doing that kind of research, and I run something called the Center for Practice Innovations, which is a state-supported, what we call intermediary organization that supports the delivery of evidence-based practices throughout the state. My focus has largely been on schizophrenia and psychotic disorders, in part because of my family experience, and I've been very involved with NAMI and with family support and family advocacy and consumer and peer advocacy.
So if you wanted to sort of focus on the OnTrackNY program now, could you explain what it is and how you are involved with it?
So OnTrackNY is a program that serves individuals from 16 to age 30 who are within 2 years of the onset of psychotic illness that is sort of in the schizophrenia non-affective spectrum. So it's not just schizophrenia, but those sorts of disorders. So we serve young people who started to hear voices or have had some trouble with their thinking. And what we really try to do is our model is based on a whole body of research and science that suggests that if you intervene, that is, if you provide services and engage people in services relatively early, so before their illness has gone on for years and years and years, and with really youth-based, person-centered, recovery-oriented, engaging care, as opposed to here's your prescription, come back in a month, that kind of care. That's not the kind of care we want to provide. If we provide care, sort of the right care at the right time, people can do really, really well. And we're learning every day more of how to do that and how to provide that kind of care effectively. And it's not a cure. People have very individualized responses, but the basic idea is we want to provide really youth-friendly services that go to where the person is, not impose some kind of model of illness and model of care on people that they don't think is that they don't want, or they don't think is helpful to them.
So could you tell a little bit more about types of services that are offered by the program?
It's what we call a multi-element based model. So what do I mean by multi-element? By multi-element, I mean it has different components. So it provides, for example, a really kind of reality-based psychotherapy or resiliency-based psychotherapy. We provide family education and support. We provide case management. We provide pharmacologic treatment and primary care coordination. We provide something that we call supported employment and education. That is help with work and school. We provide peer support. There's a lot of substance use in this age group, and so we try to address those issues. We try to address suicidality because it's also something that affects these young people. That's the components, okay? So those are the different services, but it's really important to understand that the services are knit together in a very particular way. These services are connected to each other in a team-based approach. When this happens to young people, many if not most, have trouble figuring out what's happened to them. We expect ambivalence. We expect people to be questioning. The notion of just, again, sort of ongoing engagement and recognition of the challenges of committing to this sort of treatment and participate.
If someone was looking to get help,
we have a website that provides information about each of the programs and its locations and their contact information. I think probably NAMI affiliates could help. One of the challenges that we have right now is that some of the programs are really full. And so, we're working very hard to make sure that there's availability.
So what is the OnTrack New York's Youth and Youth Adult Leadership Council?
So our youth and young adult councils, entities which provide our service recipients and graduates with an opportunity to connect, also to play a role in giving feedback, participating in projects and research, and being in a position to contribute and thereby help themselves and connect with other people, other youth. Psychosis is just a type of symptom that happens to people for a whole variety of reasons. In general, it reflects some disconnect from the most people's shared reality. The most common types of psychotic symptoms are what we call delusions, which are false fixed ideas. Sometimes they're implausible, like I have a radio in my esophagus that's broadcasting to the tree next door. So that's we call that a bizarre delusion. It's not plausible. But then many delusions are actually quite plausible. Sometimes it's hard to tell whether something is a delusion or not. Someone's out to get me. There are grandiose delusions. I'm a king, I'm a queen. Also hallucinations, which are perceptions that are not, the stimulus is not external. There's also behavioral disorganization. Sometimes they're just not making any sense. So there are these different types of psychotic symptoms, which again have multiple causes. Psychotic symptoms can also occur with depression or with mania. They can also occur with illnesses such as schizophrenia. Often, though not always, but often psychotic symptoms can be effectively treated with medication and also with CBT. Why is it important to receive treatment early? Where again, we have evidence that the shorter what we call the duration of untreated psychosis, the better the outcome. So what do I mean by duration of untreated psychosis? The duration of untreated psychosis is the time between the onset of psychosis and treatment. So if we can shorten that, let's just say, it takes 6 months from somebody to get to treatment, or sometimes it can take 2 years, 4 years, 8 years. There's a lot of barriers to treatment. Data suggests that the shorter we can make that, the better the outcome. So that's why we want to be able to identify and support people who turn out to have this kind of a set of symptoms and help them to get treatment. So a lot of times people don't tell anybody. They are scared. Or you could even have a situation where voices are telling someone not to tell anybody. Or there's a delusion that if they tell somebody, then they'll get killed, or their mother will get, there's all kinds of things. And as well as the stigma, of course, which is a really, really huge barrier to care. And it gets tied up with substance use at times. So the other thing that we know, and we don't really fully understand it, but we've been thinking more about it in the context of our focus on racism and systemic racism, that Black, particularly males, but Black people tend to be more likely to have a diagnosis of psychosis than a mood disorder compared to white people. So what's going on there is there doesn't seem to be any actual difference in the prevalence, but it may well be that how we interpret and engage, there may be differences, that are due to systemic racism, not a particular person being racist or whatever, but just that there's structures and habits and practices that we may need to really rethink in terms of making a diagnosis of psychosis, particularly with Black Americans. Well, I would call your attention to the videos on the OnTrack website. There's some really remarkable, touching stories, people telling their own stories. And you'll see in those recovery stories a young man who went from really being unable to finish his college classes to finding his voice and getting more involved with music, which is what what he had gone to college for. Again, not the illness doesn't go away, at least often generally, but people can learn to manage and live with it and live productive lives. So the services that are important probably for different people, different services. For some people, the support of employment and education is really critical. Obviously, for many people, medication is critical. The role of the peers, family support. We also know that a number of people who develop psychosis have experienced trauma of one form or another, and so really getting to a place where they can share that and discuss that is important. So we don't really know like what for any particular person what is more or less important. We do know, however, that the program model is more effective than usual care. Antipsychotic medications are somewhat protective against relapse. It doesn't mean that antipsychotic medications aren't helpful to everybody, and it doesn't mean that there aren't people who can do well without antipsychotic medications. But we do know from a number of studies in this population that if people try to go off medications, they're more likely to relapse, although not 100% of people don't relapse. So what do I mean by relapse? Relapse in general of one's psychotic symptoms.
Why is it so important to meet people where they are at and incorporate their families?
It's hard to answer that question other than to say, if someone offered you help and didn't understand that who you are and how what your values and situation is, you probably wouldn't be all that eager to connect with that person. And yet, we do this all the time. We often, in medicine, we provide care on our terms rather than on the terms of the client or the patient. And I think there's a special role, or a very important role for families in all of mental health care, but in particular for young people with psychosis. Families are often the first people to notice that something may be off. Helping families can be really effective in helping the patient, and also and not helping families can be really a problem. Because at the end of the day, at least for most people, their families are there and nobody else is, or nobody else may be. And there are people who have disconnected from their families. That does happen for sure. And there are situations where the family stress is very difficult and family challenges. I think it's really important to understand that families are often undergoing a crisis at the same time as their loved one is undergoing a crisis. And we want to empower the family and the patient to move forward with their lives.
Do you want to touch on any topic that feels most important or helpful to young adults who may be watching?
I think it's really important for young people to support each other, particularly if you or you're a friend or peer up here, is having trouble. That this is a time of developing independence and autonomy, really deeply needing one's peers to grow and develop. And young people are all, as like we all are, very vulnerable. My hope would be that young people will learn about and understand that these things happen to people, that and that it doesn't make somebody a bad person if these things happen. It makes them a person who has needs, and they themselves, to seek help, and also to help their friends, help their peers, because that could be the difference. That can change a person's life. All right, take care.
Thanks so much.
Bye.
Bye.